Let's bring in the food babe, Vani Hari. Vani, welcome to you and good to have you on the program.
For having me.
All right, first up, your thoughts on what you just heard there, and how is this movement going?
It is absolutely incredible. This MAHA commission and strategy is going to declare a war on ultra-processed foods. First, they're going to define ultra-processed food, which will have downstream impacts on any governmental program and nutrition program, hospitals, schools, and drive market for more real food. The reduction of ultra-processed food in the American diet will change our farming practices, will reduce the reliance on chemical-intensive agriculture by default. We'll need to give farmers more incentives and education on how to switch over to regenerative practices, which the USDA has committed to do. We're going to be doing a post-market review of food chemicals that aligns with current science, science that shows that these chemicals don't belong in our food, that other countries have already removed from their food, that the American food companies have removed from the same exact products they sell in other countries. Americans, for the first time in history, will be able to enjoy the same product with less chemicals that these companies already serve other countries. We've seen this in the case of food dyes. Close to 50% of the food industry has already removed food dyes, but there's many more chemicals that are going to go through this post-market review. We're going to be looking at infant formula and SNAP reform. We're going to be looking at the dietary guidelines and bringing them up to date so that we can have more informed nutrition choices for Americans, and they can make better choices for their health, which is the root of why we are so sick, why 76% of us face a chronic disease in this country.
Vani, we've only got about 30 seconds more here as there's so much breaking news this hour. But let me ask you this. Obviously, there are costs that are going to go into this. And some of the poorest diets are among the poorest in the country. So if we make all these changes that you are detailing and talk about and strip out the processed nature of so many of these foods, is there an added cost to that? And is this food affordable?
Well, the key is education and letting people know what an ultra-processed food is versus another food. And so they can make better informed decisions. And that's going to drive the marketplace. The food industry is in turmoil right now because they see the change happening. They're going to have to figure out a way to bring us whole, real food to the marketplace like they do in so many other countries that experience better health outcomes. I am really excited about this report. Not only does it cover the food thing, it also mentions direct-to-consumer pharmaceutical ads, and looking at that is going to be fundamental on how we get real information out to the American public. If there's anything they can do with that, that will be groundbreaking.
Well, there is a lot of attention surrounding this movement, and we'll keep following all of it. Thank you so much for joining us here on America Reports.
Thank you.
All right, Bill.
The Trump administration's Make America Healthy Again, MAHA commission, indicated that, after more than a decade of restrictions on whole milk in schools, the federal government is planning to drop them. The decision to drop the restrictions on whole milk sales in schools was announced as part of the MAHA Commission's Make Our Children Healthy Again strategy, a sweeping plan with over 120 initiatives released Tuesday. The initiatives cover a wide range of topics, from toxic food dyes to nutrient requirements to misleading health advertisements. Updated recommendations regarding fluoride and PFAS chemicals in water, and a new definition for ultra-processed food were among the planned initiatives as well. The Trump administration is mobilizing every part of government to confront the childhood chronic disease epidemic, Health Secretary Robert F. Kennedy Jr. said Tuesday. This strategy represents the most sweeping reform agenda in modern history, realigning our food and health systems, driving education, and unleashing science to protect America's children and families. We are ending the corporate capture of public health, restoring transparency, and putting gold standard science, not special interests, at the center of every decision. The move to bring back whole milk to schools is something Kennedy has been considering since day one, according to Nina Teicholz, a nutrition expert who was privy to discussions among Kennedy's staff before he was confirmed by the Senate to lead the nation's public health response. While removing the restrictions is a significant move, there are still additional steps that will need to be taken before whole milk becomes widely accepted again, according to the Congressional Research Service, CRS. One of those additional steps is rewriting the National Dietary Guidelines. The new MAHA Children's Health Strategy indicates that the Trump administration will update the 2025 to 2030 guidelines, while also reforming the manner in which future dietary guidelines can be updated. Additionally, the U.S. Department of Agriculture, USDA, would also initiate changes to school nutrition standards through its rulemaking process to permit whole milk in schools. Meanwhile, legislation is another avenue that could be used to streamline the process for bringing back whole milk in schools, the CRS notes, which would then compel the USDA to revise its regulations governing the National School Lunch Program. In the current Congress, a bill to bring back both whole milk and 2% milk has been approved in the House and is awaiting full approval in the Senate before it can be sent to the President's desk. Another notable part of the new MAHA, Children's Health Strategy, entails an initiative to ramp up enforcement of prescription drug advertising laws. The strategy said this includes the dissemination of risk information and quality of life through misleading and deceptive advertising on social media and digital platforms. The report notes that the new enforcement will target direct-to-consumer telehealth companies and social media influencers, among others. In April, the Department of Health and Human Services, HHS, and the Food and Drug Administration, FDA, announced plans to phase out all petroleum-based synthetic dyes from the nation's food supply. The MAHA strategy indicated this effort will remain ongoing as the FDA continues to pass policies that will either limit or altogether prohibit the use of petroleum-based food dyes in all food products approved in the United States. Other initiatives include providing a government-wide definition for ultra-processed foods to support future policy activity, efforts to require better transparency in food labeling, new recommendations regarding fluoride and PFAS chemicals in water, updates to the generally recognized as safe standards, changes to nutrition requirements for infant formula, and efforts to increase breastfeeding rates to ensure a safe supply of donor milk. For too long, healthcare has used a reactive approach to chronic diseases, FDA Commissioner Dr. Marty Makary said. I am pleased to support the findings of the MAHA Commission and to promote a more proactive approach, tackling root causes undermining the health and happiness of American children. Tuesday's Children's Health Strategy from the MAHA Commission follows an earlier assessment on children's health released in May. After that report was released, farmers expressed concern over what the reforms could mean for their livelihoods. However, following Tuesday's latest strategy report, at least one of those groups is applauding the Trump administration for taking steps to protect farmers. It's clear that farmers' voices were finally heard, but our work to defend their access to safe and proven crop protection tools is far from over, said Elizabeth Burns Thompson, executive director of the Modern Ag Alliance. The commission avoided some of the most damaging potential outcomes for American agriculture, but it still advanced some misconceptions about these essential farming inputs and the gold standard science and regulatory processes that stand behind them.